Later on. Now we have Anna Pinto. Anna, so we can have some technical problem, but trying again, Anna or Agnes, can you hear me? So, if we cannot have Agnes or Ana, I will go to Gabriela Sotomayor, Mexican journalist. Gabriela, can you hear me? Really? So let's see how we can fix this problem. Sorry for that. We are trying to fix the technical problem. So let's try once again. Agnes, AFP? No. Yeah. Yeah. If you cannot hear me and speak, please type your questions. We will receive them. Thank you for your patience.
Gabriela sent a question already.
Okay. Yeah. So, hello. Gabriela, Anna, Agnes, can you hear me? If not, we received a question from Gabriela Sotomayor from Mexico, journalist from Proceso. I would like to know if you agree with the call made by Amnesty on accountability, and if you can say how the rights of health personnel can be protected. They are exhausted, the pandemic continues, it has not stopped. How to help them? Many work in terrible condition, and they are fired if they complain. So who will take this question? Dr. Maria? Thank you.
Yes, thank you very much for the question. Just checking if people can hear us. So thank you very much for this question, Gabriela. You know, healthcare workers are frontline workers and need to be cared for and respected and protected for the incredible work that they do on the front lines, saving people's lives from COVID-19 and from many other infections. So all healthcare worker infections are important. Even one healthcare worker infection is too many. So we have some information on healthcare worker infections by country, and it varies quite, it's variable, highly variable by country. And from the data that we have that's received through our clinical platform, through our case report forms that come in, by country, it's anywhere between 8 and 27% of the reported cases. From data from our regional offices, this week, our regional director of PAHO noted more than 570,000 health worker infections in North and South America. And in the US and Mexico, healthcare workers account for about 14% of infections. Across our African region, it's around 5% that are healthcare worker infections. And if you look across the published studies, again, the data is highly variable. And if you look at seropositivity, which is evidence of infection through antibodies, healthcare worker infection ranges from 1.6% to over 31%, depending on the study. And if we look at PCR testing by study, it ranges from 0.4% to over 23%. And so what we understand about how health workers are getting infected, there are several studies that are looking at this, and we have a living systematic review that we are conducting where we are constantly looking at the literature. And some of the reasons why health workers are infected is because of a lack of PPE, not having adequate PPE to do their jobs, and in some situations not having the training to wear the PPE appropriately. And early on in the pandemic, when we have cases in some different wards, such as geriatric wards or other wards that weren't prepared for droplet and contact precautions for infectious diseases, they weren't trained to wear the right type of PPE. That has been changed and that has been improving. We also know that health workers are infected while on the job when they're in rest areas, if between each other, so there's transmission that's happening between health workers. And we know that there are conditions in which they are working in where there's extended shifts, not adequate rest periods, that really needs to be supported. But we also need to remember that health workers are people too, and they live their lives. And unfortunately, many health workers are also infected outside of the healthcare facility. So I think there's a number of things that we are doing and that countries are doing to protect health workers. This is a priority of WHO's beyond the pandemic, but is a top priority of WHO's to protect health workers. We have guidance that is out around infection prevention and control, so how they can care for patients safely and the type of precautions that are needed depending on the type of care that's given. Our supply chain task force has worked very hard to ship PPE to 172 countries in all regions. Millions of respirators and medical masks, face shields, gowns, gloves, goggles. We've issued trainings for infection prevention and control to make sure that all health workers know what this virus is, know how it is transmitted, know what are the proper infection prevention and control measures that they can take. But we do need to ensure that health workers are equipped with the right PPE. And I think just lastly, we do need to do more to make sure that the right conditions are in place for health workers, that they have adequate rest periods, that they have psychosocial support. What health workers are going through is incredibly difficult, and we owe so much to them. And I think just lastly, we owe the respect to them, and there should be no stigma attached to the life-saving work that healthcare workers do.
Thank you very much, Dr. Maria. We have also in the room Dr. Bruce Aylward. He is the Senior Advisor to the Director General. He leads the ACT Accelerator, and he has something to add. Bruce?
Thank you to Fidela, and thank you especially, Gabrielle, for raising this important issue of just the stress that the healthcare workers and care workers in long-term facilities continue to be under in this crisis, because we cannot give it too much attention, quite frankly. And I think Maria has done a wonderful job laying out all the things that we're trying to do collectively through the health sector, the health organizations, to try and ensure they have the tools, the training, et cetera, to take care of themselves. But I think what we have to remember, Gabrielle, when you ask what else we can do, is going back to what the Director General said in his opening comments, the single most important thing we can do is to collectively change our behaviors in the ways that are going to reduce the intensity of transmission, reduce the cases, and reduce the pressure on the health system. At the end of the day, that is the most important thing we do. We will look to our political leaders, we'll look to our health leaders to help address these issues, but we also have to look to us collectively, the general population, how we choose to work, how we choose to live, how we socialize. These are the important things that drive transmission. We've got to ensure we maintain the distance between people, the masks, and the other public health interventions, because ultimately that's what's driving transmission, that's what's putting the pressure on the healthcare system. But like you emphasized.
Thank you, Dr. Bruce Aylward. We will go now to Agnès. I was told the technical problem is solved. Agnès, Agence France Presse. Agnès, can you hear me?
Yes, I can hear you.
Oh,
do you
welcome,
hear me?
Agnès. Just ask your question.
Okay, great. I will ask it in French. D'après les médias suisses,
according to the Swiss media, figures have shown that there has been no excess mortality linked to COVID during the first 3 months of the year. The situation, however, would appear to be different in other countries in different parts of the world. My question then is this: does WHO have statistics demonstrating excess mortality rates from the beginning of the pandemic or otherwise, and are there regional variations?
Thank you, Agnès. Dr. Maria?
I can begin, and maybe others want to jump in. So you highlight a very important aspect of a pandemic or any emerging pathogen as this pandemic evolves. It will be identified as we retrospectively we go back in time and we look at deaths, and there are systems that are in place in several regions and several countries that are looking at excess mortality. The one that I'm most familiar with, and there are others, is the one that's in Europe. That's the Euromomo project, which is looking at excess mortality over time. And as you point out, there are some variations in excess mortality by country. I think it's too early to make conclusions about this because this is something that is ongoing. But I think it is important to recognize that deaths from COVID are likely to be undercounted at the present time. But countries are working very hard to better understand this. We do also need to be looking at other causes of mortality that are occurring during the pandemic because people have not been able to access the care that they need. So it is really critical that we get essential medical services and life-saving services back online so that people who need the care that they need can receive it and can receive it safely. And so that is something that all countries are working very hard on. We are working very hard on to support countries to be able to do. But I think we will see some differences in excess mortality, and we are tracking the systems that are currently in place that are collecting that information.
Thank you, Dr. Maria. Dr. Bente Mikkelson would like to add something. Please go ahead.
Thank you very much for the question. And as Dr. Tedros said, we have had several surveys which show that we have major disruptions in the case of non-communicable diseases, cardiovascular diseases, cancer, diabetes, and respiratory diseases. So far we have comorbidity studies from single countries, and we are working on this also at a global level. So of course it will be very important to trace what you're actually saying, because we really need to know if this will again dwindle the achievement of the SDG 3.4, namely to reduce the mortality from non-communicable diseases. So we don't know this yet, but from studies we know, and the good thing is that the majority of countries have actually now started to register comorbidities in their hospitals. So we know that, for example, in Mexico, diabetes were the most frequent comorbidity in the registered deaths for COVID. And we see other figures like in Italy, among those dying in hospitals, we see 67% of people living with hypertension and 31% living with diabetes. So this is, of course, very important both for the current situation, but also to understand the picture and be able to close these gaps with the guidance that WHO can give. Thank you.
Dr. Bruce?
No, Agnes, you raised a really important point about this excess mortality data. And as Maria laid out, many countries do track excess mortality, not all countries, so we don't have data from all over the world. And as Maria said, it's actually tracked differently in some countries, so we don't have exactly comparable data. But what we do know very, very clearly is that there has been more mortality during this period than the numbers from COVID-19 alone tell us. And that's extremely important. Some of that excess mortality is probably COVID disease that was not recognized or reported, but then it's also telling us that this incredible impact on the health system that Gabrielle asked about earlier is having a real cost in terms of human lives. And this all emphasizes the importance of the measures that the Director General has just emphasized day after day after day, because there's a real cost in human lives that go beyond the numbers that we're seeing in the COVID numbers alone.
Thank you all for these answers. We will go now to India to ask Aziz Ahmed from Hello Mumbai. Aziz, can you hear me? Please unmute yourself and ask your question. Aziz? I was told he's no longer online. If not, we will go to Ana Pinto. Ana, can you hear me?
Yes.
Hi, Ana. Just ask your question. Thank you.
Okay. Earlier this week, the president of Brazil, Jair Bolsonaro, was approached by a citizen who asked him not to deploy vaccines against COVID-19 in the country because, according to him, and I quote, vaccines are dangerous. And Bolsonaro replied to him that the government will not force anyone to get vaccinated. My question is, I'd like to know what is the WHO message for people who believe that vaccines are dangerous, and what can be done to counterbalance anti-vaxxers movements and disinformation? Thank you.
Thank you, Anna. I believe this question is for Dr. Soumya Swaminathan, our chief scientist. Soumya, you have the floor.
Thank you, Fadela, and thank you for that very important question. I think this is really a topic that everyone around the world is discussing today. I think the first thing to remind ourselves is that vaccines are life-saving interventions. And if you think about diseases like smallpox, like polio, like measles, that used to kill hundreds of thousands and maim millions of people around the world, it's thanks to vaccines that we don't see those diseases today. So we've forgotten what smallpox is like. We've forgotten what polio is like. We've forgotten how measles kills, used to kill millions of children, still does kill hundreds of thousands of children, unfortunately, around the world, despite the fact we do have a very safe and effective vaccine for measles. So we have to put in perspective vaccine and what they've done for humanity. We the public that vaccines that are recommended for use by WHO and by the national regulatory authorities would have passed the minimum standards needed. We've also heard very encouraging statements from a number of the vaccine developers and the heads of those manufacturing companies, that they will abide by the standard guidelines and rules for development of vaccines. So there needs to be, I think,